Apex Cake Home Care is in Auburn, right on Southbridge Street. And I gave out some brochures. This brochure is for skilled care. What does that mean? How many of you are on Medicare? Everybody, I hope? Okay. So, if you wind up in the hospital for whatever reason, you've been in the hospital for a few days, and you're ready to go home, and you have 3 activities of daily living that you need help with, and you're by yourself, you would qualify for skilled nursing care at home. Everybody understand that? Yeah. Okay. So what are activities of daily living? Well, activities of daily living are being able to feed yourself, being able to be continent of bladder and bowel, being able to ambulate, to walk around, being able to get out of bed and stand up, or transfer from a bed to a chair, okay, or transfer from a chair to standing up. That's all transferring. So, if you're deficient in 3 activities of daily living, and you've been hospitalized for a few days, you're entitled to Medicare benefits under skilled nursing care. So when my husband had knee surgery back in Boston, when he came home, he didn't need skilled nursing care because I was home to take care of him. And I could cook for him and help him if he needed help standing up or whatever. So we didn't need to have a skilled nurse come in. However, we needed physical therapy to help with his rehabilitation because he had a total knee replacement, okay? So Medicare paid for that. Now the second year that he had the other knee done, while he was in the hospital, a nurse came to him and said to him, "Mr. Caplin, you have been borderline diabetic for a few years, and now you're diabetic." So when he came home, even though I was there to take care of him, they sent skilled nursing care to check his blood sugars and to give him some diabetic training on what to do and how to manage his diabetes. So we had a little bit of extra nursing care besides having physical therapy, because even though I was home to take care of him, he needed a little extra help because he now had a new diagnosis of diabetes. Now, if he had been alone, if I hadn't been around, besides skilled nursing care, he might have been approved to have certified nurses' aides come in and help him as well. What is the difference between a certified nurse's aide and a home health aide? Does anybody know? Okay. A certified nurse's aide has to go through training and be licensed by the state of Massachusetts, just like a nurse, a registered nurse or a licensed practical nurse. So what do certified nurses' aides learn that home health aides don't? Well, I could be a home health aide. I'm not a nurse. I have a master's degree in healthcare administration, and I've been an educator. I have a master's degree in education, and I have a master's degree in healthcare administration. But I don't have a degree in nursing. So I could be a home health aide. I could come into your house, and I could do a little extra light housekeeping for you and maybe cook a few meals and go to the pharmacy to get your medications, and I could take you in my car and take you to your doctor's appointments. However, I'm not trained as a certified nurse's aide, which means that if you came home from the hospital after having surgery and you needed help getting out of your bed and transferring into a chair, I haven't been trained how to do that safely. Only a certified nurse's aide is able to do that safely. They have to be trained. So that's the difference between a home health aide or companion and a certified nurse's aide. So we provide skilled nursing care and certified nurse's aides under your Medicare benefit. If you're on Mass Health and you need extra services, or you're on a SCO program, a senior care option, where you have Medicare and Mass Health under one insurance policy, you are allowed to get extra help under Mass Health. Okay? So if you're living by yourself and you need a little extra help, Mass Health can provide it for you. If you don't qualify for Mass Health, then you would have to pay for it out of pocket. So that's the difference between Medicare and Mass Health. We also have a second brochure on behavioral health care. Behavioral health care is specifically designed. We hire experienced psychiatric nurses who come in and help people at home with Alzheimer's, dementia, depression, bipolar, any kind of a mental illness, and we can help with that. Some people who suffer from dementia, some people who suffer from depression or bipolar, may also have physical problems. Say you have diabetes, and you have a heart condition, and you have depression. We can handle all of that. So that's why there are two different brochures on your table. So this is Apex K Home Care, so I wanted to tell you about that. Today we're talking about shingles. Everything you ever wanted to know about shingles. Okay, how many people when you were young had chicken pox? Okay.
Yeah, but we didn't have injections. We didn't have the shot.
No. So when you were young, you had chicken pox, you were exposed to that virus. And chicken pox, that virus, like other viruses, like Lyme disease, which is kind of a virus, like syphilis, which is a kind of a virus, there are certain viruses that even after you've been exposed to it, it lies dormant after you've had an outbreak, and it stays in your body. Some research says that cancer is a kind of virus, and that everyone has cancer cells, but it takes something to have it wake up. So the chickenpox virus, the herpes zoster virus, lays dormant in your body, and that stays there. However, sometimes it comes back up in the form of shingles. Okay, so shingles is an awakened virus of the chickenpox virus. And shingles can be very, very painful. And it can last for certain people for a long time, the pain from it. So let's talk about what shingles is. Now, so shingles is a virus. It wakes up from your body, and it causes a rash, and the rash then begins to get kind of itchy and painful, and once the rash comes, you start to get blisters on the top of the rash, and it takes about 7 to 10 days for that to go away. Now, the shingles virus, if you get the shingles vaccine, before you get an outbreak of shingles, there's a good chance that you won't get shingles. What kind of people get shingles? Well, people over 50 get shingles, usually, most people. But my son, when he was in college, got shingles, and I'll tell you why. The other reason that people get shingles is because their immune system is down. So if you have chronic illnesses, like you have cancer, or you have multiple sclerosis, you're in more jeopardy of getting shingles than someone who's relatively healthy. Your immune system is down. If you've been suffering from a bad cold that develops, say, into bronchitis, and you've been sick for a couple of months, your immune system is still down, you could be susceptible to shingles. So one of the reasons why people get shingles is because they're under a lot of stress, their body's under stress, either because their immune system isn't the way it should be, or because they're under a lot of stress, maybe they're very fatigued. There are lots of different reasons why people become susceptible to a virus like shingles. So of course the antidote, besides getting a shingles vaccine, is good health practices. It means getting a lot of good rest, good sleep. It means eating properly. It means exercising, staying active, having a positive attitude, not allowing things to get you down. All those things contribute to having good health. So the shingles is more susceptible to people who aren't really in great physical and mental conditions. So, taking the shingles vaccine, you can take that and you're pretty much going to not get shingles if you get the vaccine. However, all insurances are different. Some people have Medicare under their HMO, a managed care Medicare program like Fallon or Tufts or HMO Blue or whatever those are. You have to see which pharmacy is going to give you a good copay, because some pharmacies can charge you $50 for a copay, and other pharmacies can charge you $140 for a copay.
200.
So you need to call around and see where you're going to get the best deal on your copay. Now, managed care clinics, they should be able to cover that reasonably well. You know, I live in Connecticut, right over the Webster border into Thompson. So when I went on Medicare, and my husband went on Medicare, it was better for us to stay on Medicare and get a Medicap supplemental insurance, so we have AARP, because if we had taken an HMO Medicare program in Connecticut, we would have had to go to Connecticut doctors. But all our doctors are in Worcester. So I wanted to keep my doctors, and I wanted my doctors to be able to make decisions about my health care without getting permission from an insurance company. And so that's why I stayed on Medicare with a Medicare supplement. So if you have an HMO Medicare program, you want to see if the clinic that's affiliated with your HMO will cover the shingles vaccine at a reasonable cost. Okay? So, the vaccine will help. How do you prevent shingles? Well, you know, besides the fact that your immune system is down, or you've been ill, or you've had some kind of a trauma, either emotionally or physically, you know, a car accident is a trauma. Having a death in the family can be an emotional trauma, okay? If you, do you think that shingles is contagious? Anybody?
Yeah.
It's highly contagious. You know how the measles has broken out all over the place because of the lack of vaccines? Well, shingles are also contagious. So if someone realizes that they have shingles, it's a good idea not to go around kissing all your friends. Okay? Now, shingles, as I said, can be very painful. How do you know you have shingles? What's the first sign? Well, the first sign is that you get a rash. Now, shingles is very, very interesting in that it only affects one side of your body. So if you look at me and you draw a line right down my body, right from my nose all the way down, my shingles rash is either going to be on my left side or it's going to be on my right side. And it's going to go on my head, on this side of my head, or it's going to appear on this side of my waistline, or the opposite. So you can tell that you have shingles because you start to have a red rash either on your head, on one side of your head, or around your waistline on one side of your body. If you recognize that you have a rash on one side of your body, you have 72 hours to get to your doctor to get an antiviral medication that will reduce the symptoms. So if you recognize that you have a rash on one side of your body, stay away from people, call your doctor, and say to your doctor, I think I have shingles. Can I come in for an antiviral medication? And your doctor will see you and give you the antiviral medication, which will help reduce those symptoms. Now, if you don't get to the doctor, what's going to happen is that within 2 or 3 days, the rash is going to develop blisters. And the blisters can be painful as well. So what happens with this rash and the blisters? They can be, it's almost like your nerve endings are on fire. They feel itchy and on fire, and it's pretty painful. It almost feels like a bad sunburn. So you can take over-the-counter medications, pain medications, like Tylenol or Advil or Motrin, aspirin. However, over-the-counter pain medications are not the same for everybody. You need to ask your doctor which ones you're supposed to take. In 1997, I had stomach surgery. And in 2003, I moved to Massachusetts from New York, if you can't tell from my accent where I'm from. And I started to see a doctor in Worcester. And a few years ago, I was talking to the doctor, and she had all my medical records, and I was telling her that, you know, I'm an avid gardener, and I had picking up weeds, and I had a backache, and I took some Motrin. And she looked at my medical chart, and she said, Linda, you're not supposed to take Motrin. You had stomach surgery. That could cause a hole in your stomach. You can only take Tylenol. So since then, I only take acetaminophen, which is Tylenol. So you need to ask your doctor which pain medications you are allowed to take. It's not for everybody. Not every pain medication over the counter is for everybody. So you need to check. Okay. So you can take those over-the-counter medications. Another thing you can do is you want to put cool compresses on the rash to try to ease the pain. You can use Burrow solution, soak that in water in a washcloth, and that'll help it as well, or you can use baking soda. You can apply topical creams like calamine lotions to stop the itching. If you find that the pain is persisting, you can call your doctor, and your doctor can order for you prescription creams that are stronger to alleviate the pain. And your doctor can also prescribe stronger pain medications if it's really bad. Can anybody who gets shingles get it again?
Yes.
Yes. You can get it more than once. About 20% of people who have shingles can get it a second time, and maybe 2% can get it a third time. The other thing that you need to know about shingles is that even though the rash goes away after 7 or 10 days, the pain from the shingles can last for a couple of months. And in some cases, it can last for a couple of years. So, if you haven't gotten a shingles vaccine and you're over 60, hello, then you really should consider getting a shingles vaccine because it will protect you. Let me see if there's anything else I want to tell you. Oh, one more thing. The shingles, the blisters can be itchy. You have to be very careful not to scratch them because you can have bacteria under your fingernails that could cause an infection. And And if you infect the blisters, it's going to cause more problems. So you want to make sure that you don't infect those blisters as well. So cold compresses, topical creams that stop the itching and the pain. You can use pain medications and stronger creams. And that's it. Anybody have any questions about shingles? Okay, yes.
We both did get the shingles vaccine, and I was under the impression if you got the vaccine, you would not get shingles, but that's not kind of what you said. You said you might still get it.
No, the shingles, you know, let me tell you something. I just saw my doctor for my annual physical, and I asked the doctor, if I go get a shingles vaccine, can I get shingles? And she said, most likely not at all. But when I went online to do research about shingles, they said that for some people, the shingles vaccine may last only 5 to 10 years. I think it depends also on your vulnerability. Because if you're really down and your immune system is really bad, for instance, if I had, God forbid, cancer, and I was going through chemotherapy, and my immune system was really down, and I had not gotten a shingles vaccine, or I had it 10 years ago, and I was exposed to this handsome gentleman who had shingles, I might get shingles anyway, because my immune system is so compromised. So everyone has a different opinion, but in most cases, the shingles vaccine will protect you from getting shingles. Yes?
What if you don't know if you have chickenpox in your teeth? You have no record of that.
If you don't know, your doctor can order a blood test that will show whether or not you had chickenpox when you were young. Yes?
What about if you've already had shingles? Will the shingles shot do you any good?
If you already had shingles, the shingles shot would protect you from getting it again.
You will.
Yes. But you should always ask your doctor. For some people, getting the shingles vaccine is not a good idea. Because anytime you get a vaccine, you're putting part of that illness into your body. So someone who is extremely compromised with certain health conditions, your doctor may say, I'd rather you didn't take a vaccine. Anybody get a flu shot and get flu symptoms after they had the flu shot? It can happen. So always talk to your doctor first. What I'm doing is I'm giving you information. But the information that I'm giving you, you now take back to your doctor and check with your doctor for each person individually. Because your doctor knows who you are, what your medical history is, and your doctor will say, yes, you should get it, or no, don't get it. Always, always, always ask your doctor about everything that you hear. You know how sometimes you watch ads, watch the news, and broccoli is really healthy for you, and then there's a study that says broccoli gives you cancer, and then 3 years later they say, oh, broccoli doesn't give you cancer, it's okay to eat it again. You know what I'm talking about? The research, you know, they announce on TV that something's not good for you. Did you hear the latest? You can have eggs again?
Yeah.
Okay, so, you know, when we do research, medical research, someone does research and they publish a study. But after they publish a study, other researchers have to validate that research by doing their own tests. So I don't know if you were watching either 60 Minutes or Sunday Morning this past weekend, but they were talking to a doctor who created the Ebola vaccine. And they were saying, you know, they were telling the story. I think it was with Bob Simon, who just died, right? That was his last newscast. And the doctor said, well, you know, I only had enough vaccine for the 9 patients that came back from Africa to the United States, and we're trying to make more. And they're using a kind of tobacco plant that makes the drug into the vaccine for the Ebola disease. And they were saying, well, can't you make more? And he says, well, you know, we have to go through clinical studies. Why is he saying that? Because even though it seemed like it worked, every research project that publishes a study has to be proven or negated over many, many years with many different researchers testing their theory before it becomes scientific proof. Right? So that's why I say always ask your doctor about anything that you hear. You want to make sure that whatever it is that you read or don't read, that there is proof to it. It's like the measles vaccine now. I'm watching TV, I'm watching the news, and especially on the West Coast, there are a lot of parents who aren't giving their kids the measles vaccine because 5-10 years ago, some doctor published a study that said the measles vaccine was linked to autism. And so all these parents became afraid to give their children measles vaccines because they thought the vaccine somehow would give their children autism. Well, the doctor lost his license, and all the research has proven that the measles vaccine does not cause autism, and yet there's a whole group of people, young parents, who still believe that the vaccine can cause autism, even though there's proof that it doesn't. Right? So, you know, it takes a little bit of common sense. You know, we're all senior citizens here, and we've lived long lives, and we kind of know that whatever you hear, always take it with a grain of salt. If you hear something, ask your doctor, read about it, learn about it. Don't always take something just for granted just because someone says it. You know, I could be the, I don't know, the President of the United States, and I could come in here and say, aliens have landed. You know, potatoes now give you cancer. Eating oatmeal will give you autism. You know what I mean? You gotta investigate. You gotta show me, prove to me that something is real. So whenever you hear something about medicine or research, always question with your doctor. Doctor, you know me, you know my medical history. Should I get the shingles vaccine? Is there any reason why I shouldn't get the vaccine? Should I be taking Tylenol or should I be taking ibuprofen? Always ask your doctor. Any other questions? Yes?
Okay, I just wanted to relate to everybody that I did get the shingles shot, and I also got the shingles. But it was very, very mild, very minimum pain. So to me, it was very lucky that I had the shingles shot.
Okay. So, you know, the shingles shot should work, but sometimes it doesn't, but it'll reduce your symptoms. It might have been that she already was starting to get it when she got the shot. How long ago before you got shingles did you get the vaccine?
I got the vaccine about 3 years ago, and just this past year I got the shingles.
Yeah, so, you know, it can happen.
Do you have any idea what the incubation period is for contagious diseases? Because I was on a cruise ship, and this man had a horrible rash that was like that, and he was in the swimming pool with everyone. I'm saying, like, at that point, is he safe or is he contagious?
When you develop a rash, when the blisters, when you first see the rash and then it develops into blisters, you're contagious. Once the blisters begin to dry, you're no longer contagious. Yes?
In Auburn, the CVS on Southwood Street is one of the places you can get the shingles shot.
Okay, so CVS is a place, Walgreens is a place, but as I said, check your insurance with your pharmacy.
I know CVS doesn't cover mine, Walgreens does. You
Right.
really do have to check with your
You really do.
prescription plan.
Because if you go in blindly and you say, okay, I'm getting the shingles vaccine, and they say, okay, here you go, and they give you the shot, and then you go up to the counter and they say, okay, we want $150 copay. You know, what do you mean $150 copay? So always check. Always check, because different pharmacies carry Medicare Part D. And your Medicare Part D depends on your insurance, where you can get the best copay. That's right. In fact, you can call your insurance company and say, my doctor says I should get a shingles vaccine. I would like to know where can I get it under my insurance and what will the copay be?
And they should be able to tell you that.
And they should be able to tell you that.
Because the pharmacist told me right here when I was inquiring about it, he looked it up, my insurance information.
Right.
And he told me.
Or you walk into the pharmacy with your insurance cards and you say, this is what I have, what is it going to cost me personally for a copay for the shingles vaccine? And they should be able to tell you. So don't go in blindly, always ask. Yes?
When we got our shot, we had to actually go to the hospital to get it because it has to be refrigerated.
It does have to be
It does have to be
refrigerated.
But you can actually get it in the pharmacy?
Yeah, that changed. The pharmacy started carrying it.
Yes. And this is why so many people have been asking me to do a healthcare presentation on shingles, because there's been a lot of controversy about it, because all of a sudden, every commercial was about a shingles vaccine. And it was like, okay, what's the deal? So, yes, you can get it in the hospital, you can get it at a medical clinic. Now, my doctor's office doesn't give it to us. I got a pneumonia vaccine in my medical office of my primary care physician, but I have to go to a pharmacy to get the shingles. I don't know why.
Because they don't have
My
it
doctor
refrigerated.
didn't carry it.
Right. You know, it's crazy now with healthcare. My husband he still has it. He has this infection on his skin on the side, and it was getting very red and puffy. And I said to him, you need to lance it and let the infection out, or we need to go and get it done in the emergency room. You can't go to a doctor because the doctor says, oh, I'm not going to do it in my office. You have to go to an ER. It's like, aren't you a doctor? But, you know, it's so specialized now that, you know, to get anything done, you have to go to a specialist for everything. So even a general practitioner or a family doctor will tell you, oh, no, I can't lance your blister. You have to go to the hospital for that. So, you know, but always ask your doctor about everything. It's very important. Any other questions? Okay, well, thank you very much.